Hello and welcome. You're watching UATV News with me, Ksenia Bugay. Fresh water shortages continue in the occupied Crimea. However, they will not cause a humanitarian catastrophe. This is the opinion of the head of the Majlis of the Crimean Tatar people. Mustafa Djemilev is sure that Moscow will not allow a critical shortage of water on the peninsula, but in case Russia resolves this issue, it will be done for propaganda purposes only, not out of concern for the Crimean residents. At the same time, Djemilev assumes that the method of desalination of seawater will not be used due to its cost.
The water shortage in Crimea is very acute, but not catastrophic yet. Although every day the situation is only getting worse, nevertheless I don't think that Russia would allow a humanitarian catastrophe in Crimea. Not because they feel sorry for people, but because it will deal a serious blow to their propaganda, which is based on the fact that by occupying Crimea they made local inhabitants very happy.
An innovation in the Ukrainian organ transplantation policy. On January 1st, the Unified State Information System for Transplantation was launched in Ukraine. Now, the Health Ministry promises to do everything possible to double the number of necessary organ transplant operations. Our correspondents have studied the issue and have a report for you.
This is a video of a unique surgical operation. On New Year's Eve, surgeons of the Lviv Clinical Emergency Hospital saved 4 lives at once. They've transplanted a liver, heart and kidneys from one donor. Every year, 5,000 Ukrainians need organ or tissue transplantation. Patients had to travel abroad and pay enormous sums for life-saving operations. Our country, as well as our patients, were dependent on other states. Whether a patient is treated there or not, whether a patient's life is saved or he is refused the necessary transplantation. In fact, there were only 2 states providing transplantation operations for Ukrainians. The Health Ministry hopes to change everything in the following 3 years. Ukraine is going to cooperate with the Global Observatory of Donation and Transplantation. This will speed up the acquisition of transplant independence. We want to achieve transplant independence in 3 years. This means every citizen who is in need of an organ transplantation or bone marrow transplantation will be treated in his own country. There will be no necessity to go abroad. The next step is providing Ukrainian specialists with an opportunity to undergo training in the world's leading transplant clinics in Israel, USA, Spain and India. Besides, Ukraine is also developing modern training programs in the field of transplantation. It's great that the Ministry of Health is establishing cooperation with other countries, with hospitals in other countries, so that they can really accept our Ukrainian specialists for internships, for them to learn something new and gain experience. Yet Ukraine should develop its own system like the whole civilized world did. In 2021, Ukraine plans to transplant kidneys to all patients who need it. The Ministry of Health has already allocated more than $17 million for transplant operations. In 2021, all patients who need kidney transplant will be operated in Ukraine. They won't be sent abroad. This is a challenge for us, and we are sure we can cope with it. Our aim is achievable. Since January 1st, 2021, the Unified State Information System for Organ and Tissue Transplantation works in Ukraine. It contains all the necessary database about donors and recipients. The systemic development of transplantation in Ukraine would be impossible without it. Reported by Vadim Kramer and Vlada Tsurkan, UATV News.
A little more than 3,000 cases of COVID-19 recorded over the past day in Ukraine. This is a data by Ministry of Health. Despite the decline in morbidity, doctors say it's too early to relax. Indeed, because of the frost, people more often remain indoors, and the coronavirus is not afraid of cold weather.
While Ukrainians are enjoying the winter weather and snow, infectious disease departments in hospitals are being filled with COVID-19 patients. Doctors say freezing weather contributes to the spread of coronavirus.
Our weather has changed. Cold is an uncertain factor. People stay indoors for a long time, and density is very important in this case. This is a very aggravating moment. If there is no normal ventilation and if there is a source of illness, then almost everyone in this place will be infected.
It is difficult to forecast the spread of COVID-19, experts say. The mass festivities, crowds on holidays, these are the reasons why in winter the number of cases usually increases. Frost will not play a role in the fight against coronavirus. On the contrary, at -20, the virus can live up to 2 years.
The coronavirus could bring some surprises. It's unpredictable. We found out some strange things earlier when the disease appeared. We used to think that it is a kind of a simple viral infection, which could cause complications or even death. But this is some kind of a seesaw coronavirus. We are ready to new surprises.
Less contact and more hygiene. Ukrainians adhere to these preventive measures.
We try to go outside only when it's necessary.
Так як і всі.
We do what everyone does. We wash hands and wear masks. We are elderly people and we don't visit the crowded places. In addition to coronavirus, respiratory diseases and flu are also expected in February. The main thing is to wait for the spring warming and mass vaccination. Before that, ventilation, personal protective equipment and sanitizers will help to protect oneself against the disease. Reported by Vadim Kramer and Dina Mazurkevich, UATV News.
The sense of smell after COVID-19 can be checked using a special device. It was developed by scientists from Kharkiv National University of Radio Electronics. Though the invention is already 10 years old, it became especially relevant during the pandemic. Our journalists found out how the device works.
The rhinomanometer was developed by Kharkiv scientists in 2010 in order to diagnose respiratory olfactory disorders during the rehabilitation period after injuries. Now one could track the recovery of the sense of smell after the coronavirus during the current pandemic.
Он помогает проводить дифференциальную диагностику.
It helps to carry out differential diagnostics. If a patient has nasal breathing problems, this could be an inflammatory process of the upper respiratory tract, and if nasal breathing is preserved but the sense of smell worsens, then we can talk about coronavirus disease. The device includes mask, tube and battery. Everything is connected to a special software. Its inventor, Professor Oleg Havrunin, says that recently he has contracted COVID-19. He has lost the sense of smell for 2 weeks. In order to track the dynamics of rehabilitation, he used his own development. Various reagents were added to a special nozzle.
Нашатырный спирт, валериана.
Ammonia, valerian and acetic acid are the 3 scents we use for our research.
You can see the step state of breathing. In fact, now here is the perfect nasal breathing. If the airflow is low and the pressure drop is large, then one's nose is not breathing well. The device is being used in the otolaryngology department of the regional clinical hospital. It has received 12 patents in Ukraine and last June became the winner of the Invention of the Year 2020 competition. Now documents are being prepared for its registration in Europe.
Вы хотели сейчас получить, заявку.
We would like to receive and then submit an international application to obtain a patent in order to protect rights on the international market. This especially concerns methods to study the sense of smell. At present, the inventors are looking for investors to set a serial production of this diagnostic and rehabilitation device. Reported by Vadim Kramer and Natalia Bilokudria, UATV News.
Ukrainian service sector has been completely transferred to Ukrainian language. This norm is stipulated in the Article 30 of the Law on Functioning of the Ukrainian as the state language. From now on, the staff should address visitors in Ukrainian only, unless the client asks otherwise. Our correspondent will tell you more.
The majority of critics of the so-called Ukrainian language law, namely the Russian media, tell horrors about its norms. According to them, the main purpose of the document is to oppress other languages. All this is a fake and a reason to create an artificial conflict, Ukrainian politicians say. One doesn't have to politicize this law, talking about some oppression or humiliation of other states or national minorities' languages allegedly foreseen by some laws in our country. Our constitution guarantees the free use of languages of national minorities. Any Ukrainian can speak any language he wants in his everyday life and the state only welcomes this. The more languages Ukrainians know, the better. Only the service sector is regulated by the law. The communication of staff, information about goods or services, all this should be in Ukrainian. These norms are a must for catering establishments, museums, libraries, shops, banks and gas stations. But a client can receive the service in any other language.
За проханням клієнта.
At the request of a client, if he or she asks to be provided a service in Romanian, Hungarian or Russian, etc., and the staff has an opportunity to do it, it is not a violation. This is a normal and democratic life. People communicate with each other any way they want. Besides, there are no any language inspectors that the Kremlin propaganda uses to often talk about.
Порушення, якщо персонал.
If the staff refuses to provide a service in Ukrainian, then it's violation. But let me remind you, the customer's request is still the priority. The law does not oppress one's right to use any other language.
В законе ни слова о русском языке нет.
The law says nothing about the Russian language, as well as about any other language except Ukrainian. The staff is obliged to speak Ukrainian. If asked, they can speak any other language. I believe that this is not a problem to use any other language at all. This law does not oppress other languages.
I'm okay with this law. I can speak Russian fluently. I'm absolutely fine with people who speak Russian. This law is not a problem for me at all.
Reported by Vadim Kramer and Artem Golub, UATV News.
That's all for now. Thank you for watching. Stay tuned. More updates on our official website, YouTube and Facebook pages.